This gentleman is 37 years old, and you had ACL surgery in 1994. And I'm going to demonstrate his Lockman and pivot shift to you. And we did a medial meniscus transplant 5 years ago.
Yes.
And that's been so far very successful for you, hasn't it? It's allowed you to do activity and maybe even a little bit more activity than you should be doing. So can I examine your knee?
Yes.
And just get nice and relaxed. And he does have a very good result in terms of the Lockman. And you can feel a hard end point. But the point I wanted to make is that his pivot shift is positive. And you can see that it is a positive pivot shift. And it's not coming all the way to a, well, there's almost a full thud clunk. So if I really work at it, that's a fully positive pivot shift test. And this demonstrates from his ACL standpoint, we did see a graft that was present. And if we look at his radiograph, we can see that he has a vertical ACL graft that was performed with a transtibial technique back in 1994, and this is a vertical graft which can give you then a negative Lockman test but still allow a pivot shift test. He still has some medial compartment space left, which is good, but this is starting to narrow down, and of course the meniscus transplant was done approximately 6 to 7 years after a prior meniscectomy.